friends, welcome back to my YouTube channel. I'm Dr. Ritu. I'm a homeopathic physician. In my last video, I told you about Aconitum napidus, only the mental generals and the physical generals. But in today's video, I'm going to tell you further about Aconitum napidus, the marked features of aconite. The very important feature of aconite is the suddenness and intensity with which it works. The suddenness is the acuteness. As we know, this medicine is prescribed in the first stage or the very initial stages of any acute illness. That shows its suddenness and intensity. The second important marked feature is the prescription of aconite in fevers. Fevers are few of the cases which are very complicated to deal with homeopathy. But aconite is one medicine which is prescribed very beautifully in fevers. But mind well that it should not be prescribed in each and every case of fever. Why? Because aconite, as we know, is a poisonous plant. So it should not be prescribed in any case of blood poisoning. And it should not be prescribed also in the cases which bring about eruptions. Like scarlet fever, like typhoid fever, they bring about eruptions. And to just settle down those eruptions, we should not never ever prescribe aconite. Aconite has that marked feature of dry, intense heat with burning thirst. Burning thirst, as I've told you earlier, what kind of thirst aconite has? Aconite has thirst for cold water, unquenchable thirst for cold water, large quantities at very, very small intervals. This is a very marked feature of aconite. Now, aconite is one medicine which should be prescribed in only the congestive stages of inflammation. As we know that aconite is beautifully acting on inflammations, but only the congestive stages of inflammation before the localization takes place. When localization comes in, belladonna is the medicine. In the congestion, where the skin has that burning, redness, dryness and heat. Dryness is very important, because aconite rarely perspires. Now, aconite has one beautiful action over the whole respiratory tract. That means it is a medicine which can be given in the very initial stages of cough and croup. The kind of cough aconite has is the hard, rough, dry, very ringing, racking, very dry cough. That means it is so dry and painful that the child even grasps his throat before coughing. He has so much of pain that he usually hold his neck and hold his throat before coughing. It applies a lot of strain over there. It has a lot of pain over there. So it is beautiful acting medicine on the respiratory tract. Dr. E.B. Nash found aconite a beautiful medicine to be prescribed in cases of pleurisy. That is why he involves aconite in the cases or the trio of pleurisy along with bryonia and sulfur. That means that trio of pleurisy is aconite, bryonia and sulfur. One marked feature of aconite's cough is that he coughs only during expiration. You are not going to get this symptom very easily and not always, but it is a very marked feature that cough during expiration is aconite. And one more medicine is colchicum. As we have cough during expiration, so do we have cough during inspiration? Yes, the medicines are bryonia and spongia. One more important and very marked feature of aconite is its action and the heightened sensibility. Aconite is a medicine which has heightened sensibility. The acute sense of smell, the acute sense of pain due to nervous irritation, the noise, he has heightened sensibility towards noise. That is why I told you earlier that he has great sadness and do not like music. This is the cause. Aconite is a medicine which not only is prescribed in heightened sensibility, but it can be also prescribed in cases of hemorrhages, convulsions and paralysis also. But the important thing is, it is prescribed in the very initial stage, when the hemorrhages are bright red profuse, when the paralysis is due to fear or very sudden attack, or with numbness also, or the convulsions have the sudden attack of epilepsy due to fear or fright, then you should think of aconite in the very initial stages. Aconite is a medicine which has intolerable pain. It has severe pain with numbness. So this is very important marked feature of Aconitum napellus. Now we move on to the modalities. The modalities are very easy to remember. If we remember the Aconite's mental generals, we will be easily remembering the Aconite's modality. How? That Aconite has the fear in evening and in night. So that means he will be aggravated in evening and night. He will be worse in evening and night. And he will be better in the morning time. As Aconite's thermal reaction says that he is a warm-blooded patient. So he will be worse in warm room and he will be better by uncovering or in a cold room. As aconite is prescribed in inflammations, so aconite will be worse when lying on the affected side because there is inflammation. If he is going to have that pressure over it, so he will be worse. It's a common thing. So these are the modalities and the relationships are very important as I told you earlier also. It is complementary to coffea. It's complementary to arnica in cases of traumatism, in cases of injuries. And aconite is very much important, a chronic medicine for sulfur. It's a complementary of sulfur. Sulfur is complementary to aconite. That means aconite is an acute of sulfur in all the cases. Thank you so much. Hence we finishes with Aconitum napellus. If you find my video helpful, please do not forget to like, share and subscribe my channel. And please press the bell icon for further notifications. Thank you so much.